Hi, so today we're going to talk about whiplash injuries. So a whiplash injury is where there's a soft tissue injury after there's been a forceful movement or forceful accident to the neck, usually with motor vehicle accidents where there's a rear-ended collision. And if you think about the neck movement, it moves forcefully to the front, the chin hits the chest, but when it moves to the back, there's nothing really to stop that movement. So there's a lot of stretching and tearing of all of the soft tissues in the neck. So patients usually after they've sustained a whiplash injury or they were in a motor vehicle accident, they will start to develop symptoms about 12 to 72 hours afterwards. And the symptoms will be, it will depend on the type of injury that they have. So they might have neck pain, they might have dizziness when some of the balance receptors in the joints have been affected. They might have tingling feelings or pins and needles in their arms when some of the nerves have been affected. And usually those symptoms will resolve over a period of time depending on the injury that they've had. Sometimes symptoms may become chronic when there's, for instance, a healing of a muscle that's been injured and that healing causes entrapment of a nerve, or if there's chronic damage to the joints. And by far the most common source of pain is the injury that occurs to the joints. The facet joints then can lead to arthritis within the joint, and that can also lead to chronic pain or chronic headaches or chronic pain in the shoulders and in the shoulder blades. The diagnosis is usually almost self-diagnosed, but also assisted with a clinical examination. And if you suspect a diagnosis of whiplash injury, you might be guided to do further investigations like a CT scan or an MRI scan or an isotope scan to confirm soft tissue injury. But usually that is self-limiting and very often that is not necessary. Usually the patients have got a good outcome and a good prognosis with no permanent or no residual injury. Some or a small percentage of patients might have chronic pain because of damage to the joints, and they need a more interdisciplinary, more intensive approach in pain management, therapy. They might need pain procedures like rhizotomies, physiotherapy, pressure point therapy. But in the vast majority of patients, they've got a really good outcome with conservative management, anti-inflammatory medication and rest.